Time for a look at this week's health headlines on MedWatch today. New hope for parents who risk passing on an inherited disease to future generations. For the first time, scientists say they've successfully repaired a faulty gene in human embryos. The U.S. and South Korean team used a process known as gene editing to correct DNA that causes a deadly heart condition. The controversial technique is still at the early research stage, but it raises the hope of eventually being able to prevent 10,000 genetic disorders. Scientists say gene editing may be able to alter DNA in a way that protects not just one baby from a disease that runs in the family, but his or her offspring as well. For Nicole Mowbray, who suffers from her own genetic disorder, the possibility of not passing anything on to her kids is encouraging.
I wouldn't want to pass on something that caused my child to have a limited life or a painful life or a life of risk.
Critics of gene editing worry about attempts to produce designer babies instead of just preventing disease. Scientists studying the Zika virus say the infection probably cannot be spread through kissing or casual contact. Researchers say mosquito bites are still the primary source of transmission. When spread to pregnant women, the virus has been linked to serious birth defects. Could weight gain involve your nose as well as your mouth? Researchers looked into a possible link between smell and the effect it has on how our body processes calories. They found obese lab mice without a sense of smell lost weight, but mice with a sense of smell who ate the same amount of food ballooned to more than twice their weight. Researchers say this may show that if we can't smell our food, we might burn the calories rather than store them. Scientists hope these findings may one day help in the battle against obesity. And finally, this study confirms what you may already know and may have you thinking twice about jumping in on that slice of birthday cake. Blowing out birthday candles spreads germs, a lot of them. To test this, researchers slathered icing on 2 fake birthday cakes and had people blow out the candles on one of them. They found blowing on the candles increased the amount of bacteria on the cake by 1,400%. Sounds delicious. Every week, we like to salute an employee that goes above and beyond their job title. This week, our healthcare hero is considered a literal hero when it comes to the delicate health of babies in the NICU. Meet Josefina Marquez. She works in the housekeeping department at Clovis Community with a focus on the NICU. Her coworkers nominated her to be a healthcare hero because they say Josie demonstrates a passion for her job that no one can duplicate. In fact, they say when Josie takes time off, you can tell. Things just aren't the same. She says she takes her job so seriously because she's helping fight infection and protecting babies.
I like my job, and I like to do everything right, to be clean, good. That's what I see.
Josie says she loves her job mostly because she's helping people, and she doesn't do just what fits her job description. You'll often find Josie stepping in to help her coworkers, which she says just makes her happy. There are jobs available right now at community medical centers. All you have to do is apply. Our job of the week is for an RN supervisor at Community Regional on the float team. This full-time position is responsible for assisting the unit manager in the planning, organizing, and directing of patient care services. You'll need at least 4 years of staff RN experience. Add a bonus if you have experience coordinating clinical care and providing mentorship, education, and training to staff nurses. For a full list of requirements and to apply for this job, head to jobs.communitymedical.org. Coming up on MedWatch today, getting ahead of a vision problem, the care even the tiniest of newborns can receive to make sure their eyes stay healthy. How much milk is your baby drinking? If you're breastfeeding, the answer is tough to tell. We have advice on how to make sure your little one stays well fed.